By the time somebody has actual gallstones, usually there is a blockage. But prior to that, the bile is sludgy for a long period of time. And it might be that it's not yet calcified and is showing on a scan, yet you may be getting all of the symptoms. And that can be right-sided pain, sometimes that's stabbing pain, aching, a discomfort, or feeling like something is present. This particular tincture is known as anti-lithic, and that basically means anti-stone. But aside from that, the herbs are also cholagogues, and that means it stimulates the flow of the bile. It also aids in the production of the bile. The gallbladder stores the bile that the liver is producing, and then every time you eat, it is secreted in small amounts to help to break up the fats within the meal. And so the herbs need to support this process. They are hepatic, which means it helps the liver. They're bitter, digestive, anti-inflammatory, and really importantly, they're antispasmodic, because the neck of the gallbladder can actually get quite tight. And that in itself is really uncomfortable when bile is trying to be secreted through it. They're detoxifying and they're circulatory. So this is really useful if you're getting that discomfort on the right-hand side, or maybe you're noticing that your bowel movements are looser, maybe they're floating because fat isn't being broken down. And then look at the eyes as well. The whites of the eyes can start to appear slightly yellowish. The skin may even have a yellow tinge to it. And emotionally, you might feel frustrated, irritable, and really struggling to make decisions. The gallbladder is all about decision making. I've had such good feedback on this particular formula. So you can start slowly with maybe 3 ml, which is about 60 drops, once or twice a day. But do build up to the 5 ml, which is a teaspoon, 3 times a day around meals. Other things that can help with the biliary flow are fasting, which means abstinence of food for a period of time, castor oil packs over the liver region, a hot water bottle over the liver area. This is the right-hand side, just under the rib cage, and increasing ginger in the diet. Ginger is anti-nausea, it's also antispasmodic, and it brings warmth to an area. It's one of the reasons we have ginger within the formula. I would suggest taking this formula fairly long-term. So once you've worked up to the 5 ml 3 times a day, you might actually need that for several months before then using it as maintenance, which means maybe just 5 ml, which is a teaspoon, just once a day. But if you've got that tendency to form bile sludge, maybe even gallstones, then it is something you need to continue.